what makes you stand out from your competitors or others who are also working in the same area, but like you have been in this for more than 80 years? In your opinion, what makes this practice such a unique from
So I
others?
think what makes this particular practice unique is that it's independently owned. It has not been bought out by one of the hospital systems, and patients still know the doctor they're seeing. They don't get handed off to a nurse practitioner and they never see their doctor and things like that. And we're in the community and we actually work with patients. We don't, say, too bad, your insurance doesn't cover that. We work with them. What can we do? How can we do this? We're part of the community and they look to us for that. And we try to make it easy for them to get here.
Right.
If a patient walks in and they don't have an appointment, we ask them to sit down and we make sure we take care of them. We care about them as a person. And I think that's being lost in medicine.
Welcome to the Convergence Play podcast.
I really appreciate your time, and I was going through your profile. It is very, very impressive. You have very extensive experience. So why not we start from there? That you are, I think, right now as practice administrator with FPA. How
I
you landed this job, and if you talk a little bit about your past experience, that would be great.
So, yes, thank you. I am a practice administrator here at Family Practice Associates. Um, we see about 150 patients a day here,
That's
and
that's good.
our goal, we are in a very underserved area. We are
Mm,
not a federally health qualified center. We are not a clinic. We are an independent private practice, but due to the demographic area, we do see a lot of underserved patients, which brings its own set of challenges and logistical issues. Prior to that, I worked at another family practice office and again was the administrative director. Before that, I worked for Temple University Health System, and
mhm,
there I worked on the team that created the community health worker program.
mhm,
And with that program, again, um, we created a program to train people who were unemployed through the Department
mhm,
of Labor, and we had them become health coaches in
mhm,
a very loose sense of the word. They
mhm,
got college credits for the course that we created, which was very exciting. And we got them jobs in the healthcare system with a career ladder so they could
mhm.
advance and become, you know, providers for their families. Again, I guess I'm finding that my passion is really the underserved community. I really
Right.
feel like that's a place that frequently gets talked about, but not really actioned. So everybody talks about, oh, the poor, we have to do this, we have to do this, but nobody really like sits down at the table and says, what are we doing now? How can we make it better? And what resources do we already have to utilize that? So
Right.
that's kind of it for me in a nutshell, what I do here.
Awesome. That's good. Thank you. Thank you for sharing your story. And I can sense that you have a long experience of training people as well. And it is also a key skill set to have. Like when we talk to many other leaders, they are usually great at what they are doing. They're great at technicalities of healthcare systems and all those, but uh, this particular skill set is usually lacking. They are not so great at training because I think it requires special kind of patience and special kind of personality to be able to do that. And that's the purpose of one of the purpose of this conversation is the same, that we want to create a community where people should be healthcare leaders, healthcare professionals should be able to achieve anything together, not just talk about stuff and then go about their business, but they should be able to achieve anything together. And we should have a good community and network where, for example, somebody can get benefit from your experience. And likewise, you should also have an opportunity to be connected with somebody who can help you out on your mission. And I think it is really great that the segment of society you are serving, this is really, I think it's the purest form of healthcare. So thank you for dedicating your life to
Oh,
that.
thank
It is
you.
really inspirational. So, if again, if we talk about challenges in your day-to-day job responsibilities, what is the biggest challenge that you feel in your job?
So I think I have a couple of really big challenges, and I always say if I had a magic wand and I could wave it and fix a couple of things, one would be healthcare literacy. And with healthcare literacy, we make healthcare so complicated that the
Mm,
average consumer doesn't have a clue. They don't know how to navigate the system. They don't know
right.
how to what's available to them, what's not available to them, or how to even access what they need. Now,
Mm,
that being said, it's not just the patients. Even my docs and my nurse practitioners don't know how to access things to
right.
better serve their patients. We, and this is my shtick is that I always say that we have taken the most vulnerable populations and made it so confusing with Medicare open enrollment, with Medicare
Yeah.
Advantage plans, with secondaries, with covering it under Part D. This is under Part B. This is under Part G. We took the most vulnerable population that
Yeah.
had the least computer knowledge, the least healthcare knowledge, and threw this at them and said, okay, now figure it out.
Right.
It just it just drives me crazy. And from
Right.
November to December, I spend
Mm,
40% of my day talking to seniors and patients, explaining to them what their health care is and how
mm,
they need to manage it and what a deductible is and what their copay is and why this
right.
plan is $20 more, but this plan is,
Right.
better for them. And it, it's just the biggest hurdle that I have.
Right. Understood. So, do you feel understaffed? Do you feel that you need more manpower to better navigate this?
Absolutely. It's costing me as an administrator. I have to hire somebody full time to
Mm,
just check insurance verification, insurance
right.
eligibility, make sure
Mm,
that we're in network, that they're in network, that they have the right PCP. Then I have to hire somebody else to just do the prior authorizations. I
right.
mean, my prior authorization clerk is on vacation, and you caught me
Mm,
doing prior authorizations today. What a
yeah.
nightmare.
Mm. Understood. Understood. So we always, um, I mean, everyone talks about the all the evolution that all the advancement that is happening in technology and artificial intelligence and all those buzzwords. Do you see that technology is going to make things easier in this situation, or they are going to make things complex in your understanding?
So I'm hopeful. I'm always hopeful.
Understood.
I went to the Medicare Quality Conference,
Mhm,
and there they were talking about interoperability, which is one of the panels that I was discussing. And if we could make that a reality,
mhm,
that would be wonderful. I spend more time reinventing the wheel. For
mhm,
example, I had a patient today who needed a continuous glucose monitor. Now,
mhm,
they've had diabetes for the past 10 years. They take
right,
insulin. However, I had to fill out the prior authorization, fax the notes, do all of those things, and nothing has changed. If that were
mhm,
held in a technologically available repository, it would be so simple. Mrs.
right,
Jones has this disease. She gets this medication. But as soon as they change insurances, well, that's not
mhm,
covered anymore. And we have to change this. So I do think there's a big spot that technology could fill the bill
mhm,
and it could kind of come across and we would know what's going on. But it's taken a very long time to get there.
right, right. Understood. So I think I was looking at FPA's history, and seems like you folks have been serving for a very long time. I mean, as far as I read, you have been in this business for from 1940s, I guess, somewhere
Yes,
around that.
the
So it's a
first
very
owners delivered babies. They actually
um,
family practice docs delivered the babies.
right. So it's such a legacy to be proud of. I'm sure it's like more than 80 years, and it's such a legacy to be proud of. And what makes you stand out from your competitors or others who are also working in the same area, but like you have been in this for more than 80 years? What make, in your opinion, what makes this practice such a unique from others?
So I think what makes this particular practice unique is that it's independently owned. It has not
Hmm.
been bought out by one of the hospital systems, and patients still know the doctor they're seeing. They don't get handed off to a nurse practitioner and they never see their doctor and things like
Hmm.
that. And we're in the community and we actually work with patients. We don't, say, too bad your insurance doesn't cover that. We work with
Right.
them. What can we do? How can we do this? I know I personally, I've written a couple grants to help get some coats and shoes and food for when it's cold and things like that to give to the patients. So we're part of the community and they look
Mhm.
to us for that. And
Right.
we try to make it easy for them to get here. We
Right.
if a patient walks in and they don't have an appointment, we ask them to sit down and we make sure we take care of them. Um,
Right.
we care about them as a person, and I think that's being lost in medicine. I think many times patients, and myself included as a patient, people in medicine seem to forget that this is the most personal thing a person can have is healthcare.
Mm.
We
Right.
all have it. We all are exposed to it. We're all in it. And without healthcare, without good health, you're you're in bad shape. So it's something that we all strive for, and
Right.
when it's not treated respectfully, I think that's a problem. And I think that's what I'd like to think our flagship is here is that we try to treat everybody respectfully. We try to understand what is it that is the problem. Did you have a personal emergency? It's not we don't rubber stamp anything here. I think
Right.
that's the big
That
piece.
makes
And I think as I've been part of the healthcare systems, many times you just get lost in the sauce. I mean,
right.
you don't even know. The doctor tells you to get a test done and you don't know where to go, you don't know how to do it, you don't and I we try to make sure that people understand that. We try to understand, do you need help scheduling that colonoscopy? Do you know where you're going? Do you understand what you have to do? And I think it's just that old grandma thing, you have to treat people nicely.
I see. Yeah. You're right. I think healthcare is very fundamental human right, and I think it should be treated with little bit more uh, kindness. And glad to hear that it's being done at FPA. And I think I want to talk about because this is my passion about um, the way we sometimes look at organizations is by how well they treat or how well they groom their workforce. So you have been in business for that long, so it is a testament that the workforce at FPA is definitely being trained, they are being treated well, they are being gelled very well into the culture of the organization. So I believe you must have a big role in enabling that because of your job responsibilities and your experience with that. So how do you make sure that anyone who joins your organization as an employee, how do you make sure they understand the culture and they fit well into that?
Well, that's a really good question, and sometimes it's a hard one. I've been caught up a couple times where people just didn't quite fit into the culture that we're trying to represent.
Mhm.
One of the things that I do is I work with many of the schools, the medical assistant school in Delaware. Um, they
Mhm.
send their students here for their externship, and all of my medical assistants did their externship here, and I kept them.
Right. Right.
Um, my we do we do rotations with the second and third year residents at the hospital for family
Mhm.
practice. We do externships for PAs and NPs. So they kind of know what it looks like. And if it's
Mm.
not for them, then word on the street is that this is how the place runs. So I think we're
Right.
fortunate enough that the word is on the street that this is kinda how things are, and if you're not gonna do that, it's probably not a good fit for you. And as a
Right.
manager, I tell that people, "You know what? It's not for everybody. It's
Mhm.
okay if this
Yeah.
isn't for you and you would rather go somewhere
Yeah.
else."
Yeah. And I think it's important, and especially if a good manager, if they are also able to quickly identify that someone will not be the right fit, because what happens is that people, they spend a couple of years in an organization, then they get frustrated, and of course they are not serving up to the best of their potential. So yeah, it's again, I believe there is no right and wrong answer in identifying culture fit. Every organization has their own ways to do that, but it's good that if you bring in people and they are, the more percentage of people are staying there for the long term. And I think one of the big aspect which might be playing a role in my little experience is the purpose you give, the purpose the your clinic has. It's a beautiful purpose, and I'm sure that as a human, we all are more excited about purpose than monetary and other aspects. So definitely the pure purpose you have will definitely be adding to this situation. So if I may ask you, when we were having a conversation about how we can improve this overall system, and I talk to many people and they talk about telehealth. Telehealth is helping reduce burden on overall healthcare systems, and I have seen it making wonders in, especially in underserved communities, or especially in countries where access to infrastructure is not easy. So have you guys tried telehealth, or are you guys still doing some sort of
So,
telehealth there?
we do telehealth. We do offer telehealth services. However, as a primary care office, we struggle with that some because,
Mhm.
like I said, many of our patients are underserved. Many of our patients don't understand the healthcare system, and they don't necessarily tell us on the phone what's going on or on a video what's going on.
Mm.
Sometimes you have to see it to believe it. And,
Right.
many, many times we have patients who when we see them, we can evaluate a whole different situation. We had a couple of patients who would say, "Oh, I just have a cough." Well, you can't really listen to their lungs with a cough with the telemedicine. You can't
Right.
really give a total evaluation. And I think that my personal bent is that telemedicine is not a replacement for office visits.
Mm.
Telemedicine should be used as a supplement to check
Right.
on patients, follow
Right.
up. I
Yeah.
gave you a new medicine. How are you doing with that? Not, I'm going to prescribe a new medicine because you told me that you have these symptoms without evaluating you. And I think that that's going to cause us a lot of problems down the road that
Mhm.
we are not understanding that dynamic. Now,
Mhm.
rural areas, I don't disagree because something is better than nothing, but
Right.
we really, I don't know that we could I don't think it's fair to say telehealth can replace the regular office visits, especially for chronic conditions and people that, as they age, who knows? Somebody's legs are swollen. You can't see that on the phone.
Right.
So
Right.
I really struggle with that as far as quality of care. I just think
Mhm.
that we're missing a big piece of quality when we allow telemedicine to take over.
Right.
Again, not saying there's not a place for it, not saying
Yeah.
it's not a good thing, but I think all things in moderation. We currently
Mhm.
have a home visit nurse practitioner that I hired who literally goes to people's houses to see them
Right. Right.
because that's how important I think it is to actually
Mhm.
lay eyes and hands on a patient.
Mhm. You are right. And I think, yes, that resonates in a way that, yes, any subsequent visits in which the in person presence may not be needed that much,
Mhm,
telehealth can definitely help with those. And
absolutely.
what we have also seen that, especially in underdeveloped countries, where the disease is it's a very basic disease. So if a patient is able to connect over Skype type or video call, sometimes it helps them so much because it's a very basic disease and they just need to talk to a healthcare professional to get a basic level of guidance on their way to recovery.
I
So
agree.
if I may ask, because you work with especially underserved communities, so are you also connected with other agencies who are providing um, services, for example? Because in a big burden on the system is lack of support for social determinant of health. Many factors that impact overall that if they are taken care well from social determinant of health perspective, the overall burden on hospital system will reduce a lot. So for example, if somebody is homeless, if they have access to a home or shelter, definitely it will help them improve the quality of their health and will reduce burden on the healthcare system. Are you connected with any such agencies, or how does this work for you?
So, unfortunately, that's my biggest hurdle. And like I said, when I used to work at Temple, I had access to all of the social determinants outlets, and my community health workers knew how to access everything and do everything. Now that I'm down here in Delaware, it's not as easy to find. It's not as
Mm,
easy to tap into. There's not a resource book. I know a couple years ago I had a student intern and they created a resource binder of where to get food, where to get this, where to get that. And
mm,
unfortunately, for a small state, it's very difficult to navigate this.
mm,
And
mm.
as an independent small practice, finding a social worker is even harder. So a lot of that ends up in my office. So we try to coordinate, and I've made some friends, colleagues
Right.
in other places to farm that out. But one of
Right.
my biggest dreams would be to have that network that all the primary care offices could tap into and get those resources that people need
Right.
easily.
Right.
It's just not
Easily.
easy to find. And
Yeah.
that's where technology could really come in play.
Really help. Yes. I think we have seen systems who are basically doing exactly this, that they are connecting hospitals with the right agencies, with the right communities. Uh, and it is, I think, doing wonders in improving the overall healthcare of a big population. But yeah, it's the accessibility for solutions or systems like this is still a big challenge. It's like we know somebody, agency who is working in social determinant of health in the California, but yes, they are focused entirely for the California state, and right now they don't have presence anywhere else. But of course, if these things come into play and people have different states have access to facilities like that, I think it is going to impact
I think
quite.
that would be absolutely wonderful. I would love if I could find my dream, that would be it. I would love to be able to find that network of availability that we could have the resources to say, "I have Mrs. Smith here. She's homeless. What do I
Right.
do?" Because I'll be
Right.
honest with you, the social services departments in the state are overtapped. They get
Right.
on a wait list. It just seems like, and this is my opinion, I don't have any facts to back this up. It seems like we have a whole lot of resources. We're putting a whole lot of money out there, but nothing so combined and streamlined that we're not duplicating in silos. We're spending a lot of money on silos when we could probably reevaluate and accomplish more.
Right.
It's just
Yeah.
kind of my
Absolutely.
thought. And again, because nobody knows that the food bank over here is on Tuesday and, this one over here doesn't have any money for Thursday, but this one got
Right.
extra money on Tuesday. It's
Right.
crazy.
Crazy. Yeah. Yeah. So, um,
I know. Now I see you got me started. See, now that's my passion.
no, no, I'm loving it. I'm loving it, especially your experience is so accurate on the real challenges and the ground realities. Yes, on paper, if you go on internet and search about social determinant of health, maybe 1 dozen solutions will pop up. but yeah, they may not be available everywhere. So yeah, your experience, what you are saying is 100% accurate, and it resonates to the ground realities. But of course, if we make enough noise about it, if we make enough awareness about it, I'm sure more and more penetration of solutions like that will happen, and definitely there will be a good change. We have just a couple of minutes available. I want to ask you last two questions.
Uh-oh.
How much technology you are using right now in your clinic? Do you have EMRs? Do you have any
I like to
systems?
think for my oldness, okay, I like to think I'm pretty tech savvy. We have an EMR, we have scribes, we have virtual scribes that scribe the office notes.
Mhm,
We have a virtual check-in where patients
mhm.
can check in offline. We do the insurance verification through that. Um, so yeah, we're getting there. We do e-scribing, um,
Mhm,
and we're connected with the main hospital systems. We're connected, so we automatically get reports from them, from the
mhm,
labs, and
mhm.
from the pharmacies. So I
Oh,
think we're getting there, but
very
again,
good. That's good.
it's
Mm.
just so fragmented.
Yeah, yeah. It's many different pieces, and I think one big challenge in healthcare is also integration of all these different application, different solutions, and then there is a big giant, which of course we should not poke, is data access, because we will need a lot of time to talk about that. That these systems, they are not very flexible in sharing data among
Well,
one another.
and not to interrupt you, but one of the biggest challenges is that every time you go to integrate, the systems charge you a fortune. And as a
Yeah,
small practice, if I want to
yeah,
integrate, well, that's $10,000. Well, I just need to make this talk to this. Well, no, we can't do that. And
yeah,
every time the hospital system changes their EMR, we have to
yeah,
change it. It's just not. And again, I'll go back to my talk at the Medicare conference. That's the bottom line of the problem is that we've got all these siloed, not unlike social determinants of health, we have all these
right.
siloed things that are great, but we can't get anything together to make it work efficiently.
Absolutely. Thank you. And my last question: if someone is starting um, family practice, what advice you would give them if you want them to be successful? So one lesson you would like to share with them.
Um, be sure you understand the pieces of the puzzle. You have to
Mhm.
understand the insurance, you have to understand the reimbursement, you have to understand, and you also have to understand that if it's not written, it didn't happen.
Mm.
So if you didn't put it in the note, you're not going to
Right,
get paid for it. And
right.
while we all have glorious missions,
uh,
no money, no mission. So,
Absolute. Money is the fuel for everything.
right, right. So,
Yeah. Thank you. I mean, I love talking to you,
well,
and
thank you
especially
very much. This has been very enjoyable.
all the wisdom you shared. I'm really grateful for that. In fact, I learned a lot, and I'm sure our listeners will learn a lot too.